looking at your
All right, good morning, everybody. I suggest we get started. I know we're a little bit behind time, but that's how things go. No problem. My name is Devon Payne-Sturges, and I'm an assistant professor here at the School of Public Health, and I will be your moderator and chair for this session on food security and food justice across the Lifecourse. And I just want to say a couple words before I introduce our speakers this morning. I have been here on the faculty at the School of Public Health since 2014. And that same fall, when I arrived, UMD opened its first campus food pantry. And I'm showing you here a photo that was taken actually a couple of years ago in 2016, just outside the campus pantry. This is a student who picked up his food items. This is just outside the pantry that is now located in the health center building, right? Yeah. But when I first learned that the University of Maryland had opened a pantry on campus for students, faculty, and staff, I was actually quite surprised by that. I was thinking to myself, my goodness, there are students who are hungry, and this is something that is needed. And so I wound up getting in contact with the brains behind that food pantry, who's also in the audience right now, Allison, Lily, Jaden. And we had a great conversation about, well, what was driving the need to open this pantry. I wound up doing some volunteering at the pantry. I also talked with Allison about developing a way to collect information from the individuals who were using the pantry to better understand the clients that they were serving. But we also jointly worked together to develop and pilot a food insecurity survey that we did implement in the fall of 2015 among undergraduate students here at the University of Maryland. And the results of that survey indicated that 15% of the students surveyed met the criteria for being food insecure, and another 16% met the criteria of being at risk for food insecurity. And we also looked at the demographics of these individuals, and if the students reported being African American or Hispanic, they were more likely to be food insecure. So we shared these results of this survey with leadership at dining services, leadership overseeing undergraduate affairs, and all of this helped lead to the development and implementation of a much larger survey of students on our campus. And you'll be hearing about those results by one of our speakers this morning, Dr. Yu-Wei Wang from the Counseling Center here. But what I want to say here, for me, the takeaway is that food insecurity isn't something that happens over there. It's happening right here. And it's impacting our students and it's impacting our communities. And so food insecurity needs to be brought out into the light. We need to talk about it. We need to connect it to the larger issue of food justice. And so that's what we're hoping to get to this point this morning with the panel of fabulous speakers we have put together here for you. So with that, I just want to quickly introduce our speakers this morning. So we have four speakers. And our first speaker is Chloe Marshall, and she's with the Prince George's Food Equity Council and the Capital Area Food Bank. And she's going to be presenting on the topic of hunger among older adults in Prince George's County and the challenges and proposed solutions that could be implemented to address that issue. Our second speaker is Dr. Yu-Wei Wang. I just mentioned she's with the UMD Counseling Center, and she's going to be presenting the data results from this much larger survey that she conducted on food insecurity among University of Maryland College Park students, both graduate and undergraduates. Next, we have Alice Huang from the she's a food access planner from the city of Baltimore, and she's going to be discussing the work of the Baltimore Food Policy Initiative, especially around resident-driven processes to guide equitable food policy priorities and resources. And our last speaker is Amanda Nesher, who is a food security programs manager with Montgomery County Food Council. And she's going to be providing a brief overview of Montgomery County's food security plan, which was released in the spring of 2017. And I've asked her to demonstrate for us this fabulous new website that they have developed called FoodStat, which is publicly accessible interactive food security data analysis tool. So the idea is I'm going to have each presenter speak for about 10, 12 minutes. We'll take maybe 1 or 2 clarifying questions in between speakers, but then I want to leave enough time at the end for just open discussion. So let me pull up Chloe's presentation. Right.
Okay, great.
Take a seat.
All right. My fonts didn't come through. It looks a little different on my computer. Just realized that. That's okay. Good morning, everybody.
Good morning.
It's okay. Good morning. That's all right. So, my name is, so I didn't start my stopwatch there. My name is Chloe Marshall. I am here to talk to you today about senior citizens and the fight for food access. So today, you know, the discussion is about food insecurity, food access, food justice. And so I wanted to talk a little bit about seniors because they do face very unique situations when it comes to accessing food and in terms of food justice and what that really looks like. So aging under attack, and I really think as I went through doing this, it's when food justice is missing across the life course and you come towards the end, and this is what situations look like. There we go. So a little bit about me. I work for I wear many a hat. These are just a few. So I work for the Capital Area Food Bank. There I coordinate outreach and advocacy. I help support program expansion, and people call me when they want to get food at their site. So I will not give you my number at this moment in time because I don't have much to give you at the moment. But so I work at the food bank. Through the food bank, I sit on the steering committee for the Payne-Sturges County Food Equity Council, where I help lead with communications, but also just the group itself is a diverse group of residents who are residents and stakeholders, working to cultivate justice and economic opportunity from farm to fork. The easy version of that is just we work to make sure that everybody in this county can grow, sell, and choose the foods that they want, that they need. And finally, from actually a partnership of the Food Bank and the Food Equity Council, came about the Food Justice Coalition of 20743. So I co-chair that coalition. It's 20743 is the Capitol Heights-ish area, not Heights-ish, it's Capitol Heights area. So Seat Pleasant, Fairmont Heights, if anybody's familiar with the county. So there I work with a group of residents, one of which I am myself, and grassroots organizations that are working to make sure that food system that we restore ownership of the local food system to residents, and particularly people of color, because the area is about 90% black, if not more. Can everybody read this? Wasn't thinking through how big this would be, apparently. So I found this template, loved it, and didn't modify it too much. So next, I want to just put out a definition of food justice that we at the coalition use, and that I'm going to be kind of working from today. So here it says affordable, accessible, quality food for everyone that reflects what the community wants and fosters health and economic growth. I'm not sure if anyone here has heard of DC Greens. I imagine you have, but they have a really good fleshed out definition I'm going to read real quick because I think it's really good and kind of expounds upon this. It's to advance food justice is to recognize and address the structural inequalities in our food system. The work of creating a just food system shifts power and knowledge to community members so that they can exercise their right to grow, sell, and eat healthy food. So we're talking from the seed to the person to the waste afterward is what food justice is about, making sure the people that are consuming are the ones that are creating and have their hands on that and have control over that. So back into senior hunger by the numbers in Payne-Sturges County. We live in an aging county. We're getting older. I'm 25, but nearly a quarter of our county is age 55 and up. So you'll see about 11% of our people in this county are ages 65 and older. That's a 64% increase over the past 17 years. That's huge. Our baby boomers are back booming again into seniorhood, if you will. And about 12% are ages 55 to 64. So when I say senior, I'm generally talking about 50 plus. So if you're 50 plus, I'm not calling you old, but just for the purposes of this, I think getting older is a beautiful thing. And we want to ensure that people go into their golden years feeling golden and not tarnished. So 18% of the U.S. population currently is ages 65 plus, or as of 2010, so probably still hovering around there. In 2050, it's expected that 26%, a quarter of the population, will be age 65 and up. That's doubling our senior population, if you're not aware. So 65 is the census definition of senior. That's when you become eligible for Medicare. I get confused between Medicare and Medicaid. But also you become eligible at 50 for AARP, so if that helps anybody today. So like I said, the definition of a senior is a little loose today, but I'm generally speaking 50 up. Older people are experiencing very familiar problems. One, it's expensive to live here. The living wage for a 2-adult household is about $24 an hour. That's about $3,800 a month pre-taxes on top of that. I hear a lot of families talk about how high taxes are in the county when they pay for housing and things like that. So it's expensive to live here. Food insecurity is a very real issue. Nationwide, about 8% of all adults 60 and up identify as food insecure, not having access to enough healthy, nutritious food for a healthy life. Feeding America, I work for the food bank. We're under this umbrella, kind of coalition of food banks, 200 plus, called Feeding America. They collect a lot of data, specifically around hunger issues. About 41% of the clients we serve, or households served under Feeding America, have a family member age 50 plus. Not all seniors are living alone. A lot of them are raising children. I'll touch on that. Number 3, insufficient incomes. People aren't making enough money, and that's kind of the root of a lot of issues. But a number of our seniors in the county receive SSI, Social Security checks. The average payout is $450 a month, and for a lot of seniors, that's their only source of income. So they may not be working. They might not even be receiving other benefits. 9% of adults nationwide, it's about 5 million almost, are living below the poverty line. If you're not familiar with the poverty line, one person in a household, if you make about $12,000 or less, that's poverty line. And if you can imagine living on $12,000 in the DC metro area, that's what we're working with. And then insufficient benefits themselves. SNAP benefits. SNAP is the Supplemental Nutrition Assistance Program. Food stamps, as you might know it. I'm going to call it SNAP today. Most of the time, those benefits don't cover food. I'll touch on that as well. And only about 41% of seniors who are eligible for SNAP are actually getting it. So nearly 2/3 of the seniors that could get SNAP are not getting it for a variety of reasons, which I'll again touch on. And what I didn't get to put up here is that food insecure seniors are at higher risk for issues such as depression, heart attacks, asthma, and congestive heart failure. So food insecurity and just not having food causes a lot more issues than, I think, just being hungry or just being a little bit cranky. So I wanted to just touch on data, but I wanted to talk about seniors that I have gotten to meet. I did some interviews, very loose conversations. They were not terribly scientific, but I wanted to share from their lips to yours and make sure that the voices of people who are on the ground experiencing food insecurity, who are just hungry or struggling or whatever they put in their terms, I wanted to share those stories today. So this is what the data looks like on the ground. I spoke to about 9 different people actually, but I'm going to focus today on Julie, who, not because she's my favorite, I think she just really encompasses a lot about what I'm talking about today. So Julie's 57. You can see up here, after 19 years, I didn't even have a resume. I thought I was retiring out from there. Julie, she lost her job a few years ago of 19 years. She didn't have a resume. She hadn't been on an interview in years. She didn't know how to write a cover letter. She thought she was going to retire from this job and be able to coast from there. Or not coast, but just be able to live comfortably like you expect a job that's employed you for almost 20 years would do. So it took her 5 months to find a job. If anybody's familiar with SNAP and how that works, we're in a heated battle about the Farm Bill right now. People familiar with the Farm Bill? Feel good about that? ABODs, is that a word that comes up? Great. So able-bodied adults without dependents. They are individuals ages 18 to 55 without dependents that are considered able-bodied. They can be on, and Julie would have fallen in this category. They can be on SNAP for 3 months in a 3-year period until they find or if they don't find a job that pays $20, or not $20, that gives them 20 hours a week at least, then they will be put off their SNAP benefits after 3 months. It took Julie 5 months to find her job. So not only were benefits not enough, they weren't accessible because of the fact that she would have been taken off of them. So in her job hunt, She was too old to get hired, as that was felt like. There were younger people who could do the job faster and longer. She didn't have the resumes, the interviews. She was nervous. She hadn't actually done this process in 20 years. And then her husband, she found a job, 5 months. Her husband got laid off. He's in his 60s, facing the exact same difficulty. And this was just a few months ago. Now, they're still paying a mortgage. They're still supporting 4 of their kids who are adults like me, who call their parents when their car breaks down. So they cover those bills. And her phrase was, I would rather just give them the money than have them move back in. So there's a point, but my mom said that too. So there's a point of self-preservation there that you have to decide, am I gonna just be a little broke for a while, or am I gonna have like my kids live with me? So those are, yeah. Oh, great, perfect. So I want to talk about Julie, because Julie really embodies a lot of things that are aging adults that are moving on into seniorhood, who thought they might retire, who thought they might have things a little, easier. These are the challenges they're facing in just life. And then getting food is a direct result of that. I'm going to skim through Julie to Jeanette. Jeanette's 56. This is the message she wanted me to share. She also said, I quote, stay in school. That's something she tells everybody and her kids. She has 5 kids, several of which she's still supporting. She was at the pantry to pick up cake to celebrate her son's middle school graduation, actually. She stopped working in 2006 to grieve because her son had passed. But after that, she gets $400 in food stamps almost. They're not enough to feed her family of 4 to 6 at any given time. Her SSI sometimes covers the gaps. Finally, Denise. Denise, I didn't actually ask a question. She just started talking after that. You can believe that. But her issue was deciding between things like gas and food. Pay the electric bill or eat. And we hear that a lot, but that was literally her struggle this week. So she goes to food pantries all around the area, so she can count on that. But her food stamps, she gets $48 a month. That's it. She used to get $117, told them that, she was in a slightly better financial situation, but still stretching pennies through the month. They cut it from $117 to $48. Those are the benefits that we're working with, and those are the struggles. So I only have 45 seconds left? So I didn't come up with excellent solutions today, but I really just wanted to get those stories out to make sure that you understand kind of what people are dealing with, and that food insecurity doesn't live in a vacuum. Food justice lives in a whole system of justice. And, I'm imagining that's what we're talking about when we talk about environmental justice. So themes that stood out to me were employment, federal benefits, independence, and solutions. Maybe not so uncommon, I don't think they're not novel, but we need better hiring practices and things like that, higher benefits, and food justice throughout the life cycle so that people don't end up at this point at the end of their lives dealing with their kids who didn't have that same justice and trying to find that for themselves. How can we do it? I didn't make a slide for this, I'm sorry. If you need to do something right now, go to my job. So at the food bank, the Food Equity Council, and Food Justice Coalition, we work on those issues daily and directly. If you want to know, because justice is an ongoing conversation. That's not a one and done solution. That is a systemic work. And if you want to know more about, say, the Farm Bill or how you can advocate for better benefits, you can visit places like Maryland Hunger Solutions or FRAC, F-R-A-C, the Food Research and Action Center, to learn about the Farm Bill, how you can advocate right now, calling is everybody from Maryland? No? Okay, great. Call your state senator sometime this week and say, hey, don't support this Farm Bill, in the simplest terms. But that's my whole presentation. I hope that helps frame the conversation a little bit. Thank you today.
Does anybody have a question for Chloe while I pull up the next presentation? Any questions?
I don't bite. Ooh,
No.
that light. Yeah, please do.
Can you say a little bit more about the Farm Bill?
Yeah, so the Farm Bill right now, if you're not familiar with it, the Farm Bill is this massive piece of legislation that covers SNAP and food stamps. That's the part I'm familiar with, but also subsidies for farmers and for minority programs and supporting our agricultural system. Right now, under our current administration, there are not attempts, but real pieces of it that are going to slash SNAP benefits in the name of requirements and things like that. So we've seen, and I'm speaking from my part of the bill that I know, which is SNAP, we've seen that work requirements are really just time limits. It's just saying if you don't find a job in a couple months, you're off. And it's not helpful. It doesn't help them find jobs. There's usually not additional funding to put in for like employment training and job searching and things like that. So that's what I know about the Farm Bill, and we can certainly talk more about that later because it's a big bill.
Thank you. All right, our next presenter.
All right. Hi, everyone. My name is Yu-Wei Wang. I'm the Research Director and Assistant Director for the Counseling Center. I'm also in charge of the new student census. So we've been doing census since 1963. And also the survey that goes out to students who drop out of the university before they leave the university. This past year, I have been also doing the food insecurity study that I will share with you about some of our results. I will have to skip some of our slides, so make sure that the other speakers have time to cover their talks. So basically, we have been doing this study since the last fall semester, and we want to look at this the prevalence of food insecurity among our students, and not just undergrad students, but graduate students. We also want to look at the relationship between food insecurity and students' well-being and their academic experience here at University of Maryland. We included several scales measuring students' well-being, their academic experience, and of course the food insecurity level. And in total, in the fall semester, we sent out 22,745 email invitations to undergrad and graduate students at the University of Maryland. And among them, more than 3,000, almost 4,000 undergrad students and also over 1,000 graduate students completed our survey. So our response rate was about 22%. And that's about 12% of the total enrollment at the University of Maryland in the fall semester. So really quick, our student body is very diverse. We have about 42% of students who identify as racial ethnic minorities, and among them, Asian international students is the largest minority group. We also have quite a bit of international students who completed our survey, and a lot of international students were graduate students. Female students were more likely to complete our survey, even though that if you look at the overall enrollment at the University of Maryland, we have more students who are enrolled on campus. We do have some students who identify as transgender and or different gender identities, and I also want to emphasize that 4% of our respondents also identify as having a disability. So we use the food insecurity module that USDA published, and I think more than 95% of researchers who do research on food insecurity use the same module. So we were able to compare our findings with the other findings in the United States. So overall, 41% of our respondents reported some level of food insecurity, meaning that they endorsed some of the items in the food insecurity module. For example, I skip meals sometimes because I couldn't afford having enough to eat. And if you look at the specific breakdown, 7% of them were qualified as having very low food security, meaning that they are hungry. And then 13% of them had low food security. 21% of them reported marginal food security, meaning that they only endorse a few items in the food insecurity module. So according to the USDA module, 20% of them, our respondents were considered as food insecure. So the type of analysis that we ran were based on this scoring method. Okay, so consistent with the past research, a number of demographic factors are related to students' food insecurity. Racial ethnic minority students, first-generation college students, students with immigration backgrounds, international students, students who reported that they have a disability, students who were divorced, separated, or widowed, and also students who reported having more children in their family. They're more likely, significantly likely, to report being food insecure. So this semester we have interviewed 23 students who completed our survey, and I'm going to share just a few of their quotes to illustrate our survey findings. So for example, a first-generation college student said that in her family, they don't really have intergenerational wealth. They don't have anything to save up so that they can give to their children. And also, first-generation students are more likely to say to us that they're hesitant to ask their parents to help because they feel like they're already a burden to their parents. Their parents had to send them. They're the first one who attended college in the family. And also, a grad student with children shared with us that, and quote, "The process of having food is different with the children. I have to have food in my house ready for my children to eat. I only have to go to a couple of days without substantial food myself. Usually there was some nice rice that I was giving to my son, and I just wouldn't eat any of it. And there would be banquets that I would go to at the university, and I would take all the food I can and then give it to my son after I go home." So those quotes from the interviews illustrate our research findings. And not surprisingly, food insecurity level is related to students' financial backgrounds. Students from lower socioeconomic status are more likely to say that they work more hours on average, and they're personally responsible for more of their educational costs, and therefore, relatedly, they are more likely to report being food insecure. One of the students we interviewed identified as a non-documented student. The male undocumented student said that despite working part-time, he was not able to afford a dining plan because it was nearly half of the cost of tuition for him. Additionally, part of his income also went towards supporting the other relatives who he stayed with, lived with, and he is not eligible to apply for SNAP, food stamps, or other government assistance because of his status. And food insecure students are more likely to live off campus, and also they're more likely to report being housing insecure, meaning that some of the students have to figure out ways to find housing. For example, we have students who say that they sleep on the street or other places such as a car that's not meant for living. And our respondents who are food insecure also are more likely to say that they don't have a meal plan, and they're more likely to know someone else, a family or a friend, who also cannot afford food. And as you can see, I hope you can see from the back, that very few of them actually utilize food assistance programs such as SNAP or the pantry. And I will talk about that, the reasons for that in a little bit. So food insecure students reported that they eat less healthy food. Their general health is worse. For example, a student told us during interview that I ate pretty much only Chick-fil-A fries for a whole semester. because they were the cheapest meal I can find at the stand. We have students who told us that live on Pop-Tarts from a vending machine. And a female student told us that she would only eat 1 or 2 meals a day, and one of them is coffee. And that just, shows how the kind of food that students who are food insecure can afford. Food insecurity is also related to students' depression level, anxiety, anger. Food insecure students reported being more lonelier, and also they reported lower self-esteem. We have an interviewee who shared with us that because of malnutrition, she was so depressed, to a point that she was suicidal and was hospitalized because of that. We also had questions about the impact of food insecurity on students' academic experience. So students who are food insecure are more likely to say that they have failed the exam, missed class, failed a class, or plan to withdraw, or feeling down, develop an unhealthy relationship with food, or avoid going out with friends. And during our interviews, our interviewees actually shared that most of the time, they don't tell their friends why they cannot go out with them because they're ashamed of admitting that I just cannot go out with you because I don't have money to afford having a meal at the restaurant. We had an interviewee who said that they were going to leave the university because they just cannot afford staying, even though their tuition is covered, but they cannot find money to continue paying the rent or pay for the food. So, 1 minute, okay, wow, 1 minute. So I'm just gonna share some of the highlights from the open-ended question we had in the survey. At the end of the survey, we asked students, do you have any ideas for how to improve food access for students who experience financial hardship? And students wrote, a lot of students, even though not everyone, but a lot of students responded to this question. Some students actually wrote a lot, like paragraphs, describing their ideas, thoughts, or personal experience. So we analyzed the data, and students talk about how College Park is a food desert, that there's not an affordable grocery store that's within walking distance, and that the cost of healthy food is too high for them. The commuting students said that it's hard for them to find a way to bring their food with them because there's not a place for them to store the food when they are on campus. Grad students in particular talk about how their stipend is not enough for them to afford going to grad school and make a living, and especially if they have children and feed their children at the same time. International students also, I mentioned earlier that international students are more likely to be food insecure. International students talk about how because of the work restriction on international students, they cannot work off campus, and therefore a lot of time they cannot find enough money to afford food. So students would skip meals or eat low quality. Sorry, I'm just dropping everything. Very poor quality food. We have a student who mentioned that they're relying on their grandmother's food stamps for the family to get enough food. And some students mentioned that they will cut any other expenses that they can cut or stretch food until their family can come to visit. So overall, we saw also this in the survey findings that food insecurity has a lot of negative impacts on students' health, physical health, psychological well-being, and their academic experiences. Also, it has an impact on their relationship with their peers. And one thing that we a scale we didn't have is about stigma, but we have a number of students who talk about the issue of stigma. I'm just gonna share one quote about this. The student said, I think the major thing that I and my friends who are struggling with food access is not feeling ashamed to admit it. In addition, one of my friends was not able to afford food because she had to pay for the next semester, was afraid to spread her problems onto others because her friend said, you guys have more stuff to worry about than me. I think just letting students know that it's okay and they're not alone in the struggle would encourage more to ask for help from peers. Related to Chloe's suggestion, I think just more awareness about the severity of the issue can really, help us to bring this problem into light and then start talking about it and formulating feasible action plans to deal with these issues.
Questions while I load up the next presentation?
Yes.
Are the results public or is there a report somewhere?
So we still need to do a few more follow-up studies, interview studies. So we're hoping that in the summer we can finalize it and then start producing reports and articles.
Like on the counseling center's website?
Yeah, we will put it on our webpage.
We have a snapshot, just to cut in, we do have a snapshot of the report, the initial findings on the Campus Pantry website, which is campuspantry.umd.edu. So just the high-level findings since the full study hasn't been.
Yes.
And Chloe had that stark statistic about the large chunk of folks who are eligible, of seniors who are eligible for SNAP who don't get it. Do you think there's something similar going on with the student population who might be eligible for this assistance but don't know?
So I think one of the factors is related to stigma. For the students to talk about how uncomfortable and ashamed and embarrassed they feel about admitting that they don't have money for food. A lot of students even said that they don't want to bother their parents. They don't want to let their family know. So one issue is related to that. And then the other one is, I think, related to the requirement for SNAP, because there's a work requirement. And as a result, a lot of college and graduate students are not eligible to apply for SNAP. In fact, one of our interviewees survey respondents shared with us that she was gonna look into applying for SNAP, but she made just $50 more than the basic, minimum requirement. So she's not eligible for that.
We hold a question until we get to the end when I get to our next presenter. Okay, thank you so much.
Thank you.
All right, I will try to keep this 10 to 12 minutes. Hi, my name is Alice Huang. I am a food access planner with the Baltimore Food Policy Initiative. So who are we? We are an intergovernmental collaboration within Baltimore City. It's a collaboration between the Office of Sustainability, which is within the Department of Planning, the Health Department, and Baltimore Development Corporation. And all of us together work on food access issues through different branches, through policy, through economic development, through on-the-ground community work. Within that, we also have something called Food PAC, which is the Food Policy Action Coalition. There are about 60 stakeholders. Folks meet every other month. It's open to anyone in the community, any organizations, anyone working on food access can attend. It's an opportunity for collaboration, for networking, for idea sharing, and also to get informed about policy issues that would impact the work that they're doing in the city on food. And lastly, the one that I will be talking about more about today is our resident food equity advisors. And this is an effort that we started and piloted last year in 2017 to really be more intentional about how we really approach equity in the work that we do and how to create resident informed policies. And so last year we had 16 residents, we had 6 meetings. And so there's some photos of some of the folks even speaking with the mayor at an event. And so we really wanted to give them an opportunity to have power and a place at the table. So one of the things I want to focus on is the fact that we use food as a catalyst to address health, economic, and environmental disparities in healthy food priority areas. So what are those areas? That goes into our food environment and the mapping that we do. So in collaboration with Johns Hopkins, we do a lot of mapping in the city. What was previously known as food deserts, we now call healthy food priority areas. That name change was due to a lot of conversations with folks in the community and residents saying that they don't like to be called the fact that they live in a food desert. It's not a geography, it's an experience. So rather than saying I live in food desert, some of them say I experience food apartheid, right? What is happening to me? And so we try to change it so that we have a term that we use for policy work, but we really wanted to give residents and community a right to narrate and say however they want to talk about their food experience. So just to highlight, the priority areas are defined by 4 factors. It's based on healthy food availability score, which each store is given a score in our city based on, Hopkins has folks that go into the summer looking at stores and seeing what they stock. Each store gets a score, looking at the average in certain areas, looking at the poverty level, vehicle availability, and distance to a supermarket. And so those are the 4 factors that shape and define what is a priority area. And that's really for policy making. Just because you do not live in a priority area does not mean you don't experience food access issues. We just need a way for a citywide approach, a citywide strategy. But something to highlight, we have 28% of children live in priority areas, 24% of seniors live in priority areas, and then with the, in terms of racial equity, we wanted to really highlight the fact that 31% of Black residents live in these areas versus a little under 9% of white residents. And considering that over 60% of the city is Black, that's a pretty significant number. So we also looked at food retail. So one thing, all those pink dots are basically corner stores. So we have over 500 corner stores in our city, which is a lot to handle and a lot to track. On average, corner stores and convenience stores score pretty low at around 9.1, 9.3 versus supermarkets, which score over 27. And so this really shows you that certain categories of food retail really either offer higher quality or lower quality food access. And so when we looked at that, we really wanted to call that out and really talk about how do we create strategies around that. So first of all, we wanted to really emphasize the importance of having resident-driven processes to guide how we create policy, programs, and resources, and then also really calling out the need to improve corner and convenience stores. And that's not specific, it's not talking about food specifically, but folks overall have a general concern about corner and convenience stores, whether it's about safety or food or other issues. And so we really wanted to just bring that to light. So these are the healthy food environment strategies that we've created, but just focusing on the first 2 today. So our resident food equity advisors, this is one of our advisors, and her quote, she said, currently in my neighborhood, the only choices we have for food is takeout and processed foods from corner stores, and I feel that food security is a basic need that should be available to everyone. And so, that was something that we heard repeatedly, and with our first cohort of residents, when we looked through a slew of topics, a great focus was on corner and convenience stores, and people really wanted that focus. So based on the results of our research and our mapping, and based on the input of our residents, we realized this is something we really needed to focus on. So this year, in 2018, we are working on corner stores. It is the year of the corner store, and how we've been focusing. So we received 80 applicants. So this is the application process for our advisors. We selected 16 residents. We try to have at least 1 resident per council district so that we have representation within all areas of our city. There are 7 meetings. The residents are compensated. We wanted to really show them that they're valued, that it's not just a volunteer thing, but they really are valued for the time and commitment and the work they're putting into this. And our goal was to create resident-informed policies to improve corner and convenience stores. So with these meetings, you know, a lot of times when you go out to communities and you go talk to large groups of people, there's not a lot of deeper dive conversations. It's usually you talking at someone or them talking at you. And we really wanted to develop relationships with these 16 individuals. So through these meetings, we found it an opportunity not just to talk, but also to educate and to be transparent and to really give them as much knowledge and information as possible. So we talk about grounding first in what is food justice, what is equity, what is policy. You know, not everyone really has a full grasp of what policy means, what policy looks like, and it's not just legislation in Annapolis, right? There's a lot that comes like with regulations, zoning, ordinances, all of that, licensing. Then we talked about the state of corner stores from a research perspective, from a city perspective. We talked about zoning and corner stores. And one of the things that we really saw were when folks applied to be part of this, a lot of applications we read talked about the tension between corner store owners and the communities they live in. And there's a huge racial, cultural divide that was really prevalent in these applications, to the point that there was like a lot of anger even. And so we really thought that that was important to talk about and to call out. So we actually brought an organizer who came from DC who does work with Korean store owners in DC and really looking at the cultural and some of that racial reconciliation between these immigrant store owners and the Black community. And that's really the reflection of some of the stores in our city. And so we are trying to work through that and even have deeper conversations around that. And just also talking about different ways that corner stores function, why they are the way they are, through ordinances and business licenses, looking at how other cities are trying to do work around corner stores, talking about zoning, how that could impact it, but really trying to give these folks tools and knowledge so that they can think about how that could translate into their communities and their environment. So as we talked with them, they really created these buckets of these are the things that we value about corner and convenience stores. These are the things that we want to address. And so a lot with food, that was just one bucket, right? But a lot of it also talks about sourcing. You know, how do you make even food affordable for these owners so that it can be affordable for the residents, right? The whole wholesale distribution chain, that was an issue. Stocking, looking at people's shopping experience, the external factors, the signage of a building, the sanitation, the cleanliness of a building, looking at community safety, a lot of crime, and people talk about open air drug markets happening in front of these stores, right? Community and retail relations, really looking at addressing biases and community building, and really feeling like, how do we make this store a part of the community, and how do we help them to understand that they are a part of this community and they're just not just a business. And looking at economic factors, looking at funding opportunities, incentives, and how are there ways that we can really incentivize stores to improve, and also looking at funding in ways of how do we help local people within the community to own these stores, right? How do we help with local ownership and local entrepreneurship? So finally, with our efforts, we are on our last stretch. We have 2 more meetings to go. We are drafting our recommendations, our goals, and our strategies. And we are creating this document that actually will be going to the mayor's office, will be going to other folks, other like council members and people who actually are able to push certain things forward. And so from that, we're hoping to do some stakeholder engagement with these recommendations, talking with community, talking with retailers. And ideally, we're hoping that within the near future, we can draft some legislation on and our zoning policies and work on even business licenses. But hopefully through these recommendations that our residents are putting together, that's really going to be driving and shaping the work that we're doing. And so with that, these are our residents from last year in 2017. As you, in the middle, you have Mayor Pugh. So she met with them, really wanted to acknowledge the work that they're doing. And we are just really grateful because it is a lot of commitment, it's a lot of time, and we've been having some really amazing conversations with them, and they've been really great in calling out the things that they think are vital and bringing that information back to their communities and trying to do some bridging there. So, thanks. Any questions? Yes. Yes.
So I have a question. I was wondering if you guys utilize this. So I read a couple articles and the New York Times last year published this. or was that suburbs and rural areas, particularly suburbs of Baltimore, are getting poorer? Because I've noticed in my lifetime, places like Canton, the Inner Harbor, it's all walkable, it's all money, money especially. People can walk, but living in the suburbs, you have to like buy car insurance, you have to buy a car.
Yeah.
Getting rid. I wonder if you guys have utilized that in your research.
So, when we really our research is around food access, and I think part of that would be like vehicle availability, but we are also looking at other things, and we know the development issues. So there's a movement called Black Food Sovereignty that's happening, and Eric Jackson is part of this group called Black Yield Institute. And so we've been really looking at ways to kind of go back to like Black communities owning land, like what does it look like for them to own land and to really start growing food and land again, with long-term leasing, not just short-term leasing. And I think to what you're saying about the suburbs, I think one of the things that we've been trying to figure out is also this idea of online SNAP. So within the Farm Bill, online SNAP, you're not allowed to use your SNAP online yet. It's actually prohibited, but there's a pilot program where Amazon, Safeway, and ShopRite have won the bids to be able to develop software to figure out how to really make online SNAP purchasing feasible. There's issues that we want to make sure they think about, such as delivery and perishable items. We don't want them to just deliver canned items, but we're working with those entities to try to figure out strategies to really make sure that the strategies that they're developing with the technology that they're putting together really do address kind of what you're saying, these folks who live in areas where it's really hard to access food, that they're really serving those populations and not just the low-hanging fruits. Yeah. Thank you.
All right, we'll have our last presenter, Samantha.
Hi everyone. Well, I have been frantically scribbling out paragraphs of my what I was going to say after all this, so I'm hoping that I'm going to get through most of what I want to say, but any other questions afterwards, do feel free to email me or come talk to me. So thank you for giving me the opportunity to come speak to you today. What did I want to talk about? I wanted to talk about the work that we at the Montgomery County Food Council have been doing to combat food insecurity in the county. I also wanted to focus a little bit on the work that we've been doing around campus hunger, and then to also show you the food stack data analysis tool, which launched on the 1st of May, which is now a couple of weeks ago. Who are we at the Food Council? The Food Council was launched in February 2012, and it's an independent nonprofit that strives to bring together multiple stakeholders in the county's food system around the equitable production, distribution, and access to nutritious food. We have 25 volunteer council members and 4 working groups: environmental impact, food economy, food literacy, and food recovery and access. And members of the council and members of these groups broadly represent the food system both substantively and geographically, and include chef restaurateurs, food entrepreneurs, and representatives of local government, nonprofits, and businesses. So, for those of you who are unfamiliar with the Food Security Plan, it was co-created by the Food Council and the County Executive and released to the public in January 2017. It sets out lots of recommendations to be followed over 5 years, with the ultimate aim of reducing the level of food insecurity in the county by 22% by the year 2020. The plan was developed through public discussion forums, listening sessions, in-person interviews, and roundtable discussion groups in partnership with more than 300 collaborators, including businesses, nonprofits, local and government agencies, and food assistance providers. The shared vision for the Food Security Plan was to make our community a place where all people at all times have access to safe, sufficient, nutritious food in order to lead fulfilling lives and contribute to making Montgomery County, Maryland a place where all live in dignity. The plan was divided into 3 parts. The background and demographic section consists of an environmental scan of existing resources and programs to combat food insecurity, as well as a closer look at food insecurity risk factors like changing demographics, language and culture, and vulnerable populations. The findings section determines which populations are most at risk, what their specific barriers to food access are, and the order of magnitude for those at-risk populations. The recommendations section sets out the overarching strategy to reduce the level of food insecurity in the county, broken out into year 1, years 2 and 3, and years 4 and 5. In 2016, at the time that the plan was written, 7% of the county's population was estimated to be food insecure, which works out as 77,780 people, including 13.9% or 33,000 children. The most recent data from Feeding America show that the food insecurity rate has actually decreased to 6.3% of residents and 13.3% of children. But while this is encouraging, there's still a long way to go and a lot of work to be done to reach the goal of 5.5% or even less, hopefully, by the year 2020. Food insecurity was actually found to be most prominent in East County, Silver Spring, Aspen Hill, Wheaton, Gaithersburg, and Germantown. And research showed that there were varied, complex, and interconnected root causes for this level of food insecurity, such as living below the federal poverty level, living below the Montgomery County self-sufficiency standard, which I'll talk a bit more about in a bit, being unemployed, being ineligible for federal food assistance programs, and also not being able to access the transportation necessary to obtain healthy, nutritious food. As you can see from these charts, even though the overall food insecurity rate in the county decreased between 2016 and 2017, the SNAP rate for Montgomery County households increased from 6.7 to 6.8%. The number of children availing themselves of free and reduced price meals in schools has also continually steadily increased, reflecting the reliance of Montgomery County families on food assistance programs to alleviate their need. As you can see here, research in the Food Security Plan found that certain populations in the county were increasingly vulnerable to food insecurity, namely children, seniors, people with disabilities, and foreign-born residents. And other risk factors for food insecurity include being eligible but not enrolled in benefits, being homeless, having faith-based dietary requirements or restrictions, and working 2 or more jobs. So this slide and the following one give you a snapshot of all the Year 1 recommendations and the initiatives that are currently underway to implement them and their progress to date. I'm not going to go into exhaustive detail. You can see me afterwards or email me if you want more information, but I did want to highlight a couple of the initiatives that have been done to date that are making an impact. Firstly, the Food Council's Data Standardization Survey. This was created in 2016 to collect information about the data captured by food assistance providers about recipients of food assistance, including questions about how their information is collected, how it's stored, how often it's updated, dietary needs, employment and benefit program eligibility, family composition, and other things. And we're hoping to use the survey results to create a recommended list of standardized data sets for food assistance providers to collect from their recipients, so that we can understand the scope of food assistance resources and more effectively measure the impact of services provided and more accurately assess the level of food insecurity in the county. And another thing I wanted to talk about, which I'm inordinately proud of, is our food assistance resource directory. So this lists 77 different food assistance providers in the county with their addresses, contact information, hours of operation. It also has a spanky little map here. And the type of food assistance they provide, and if you need to make an appointment or if you need to bring documentation. We've distributed 2,000 hard copies since it's been finalized. MCPS has twice provided a link to the PDF of this in their elementary school meal menu, which then we saw a massive increase in website traffic. And we're looking to turn it into an online database. 5 to 10. Okay. How much time do I have? All right. There are loads of other things we've been doing, but I'm going to skip to campus food insecurity and then food stamp. Get that first. So. So as for college student hunger, it's an issue that's gaining nationwide attention and is the subject of numerous recent and troubling studies. The Food Council's been working with Montgomery College, Universities of Shady Grove, and Dr. Payne-Sturges here at UMD, College Park, to explore the extent of the problem and discuss initiatives that can be taken to help alleviate food insecurity from campus ad campaigns to destigmatize the issue, to the creation of food pantries, and the facilitating of listening sessions, all the way to federal level advocacy to expand food stamp eligibility under the Farm Bill to cover all students, not just those in federal work-study programs. So you've already heard from Dr. Wang about the impactful study that was conducted here. So I'll talk a bit more in detail about the Wisconsin Hope Lab report, which is a national study released in April this year. So who is today's typical student? According to the Center for Law and Social Policy's December 2017 fact sheet, 44% are over the age of 25, 26% are parents, 15% are single parents, 27% are employed full-time, 36% are students of color, and 51% are low income. The rapid increase in college costs and flat or reduced funding in student aid has resulted in significant unmet need, meaning that low-income students are borrowing more, working more hours, taking fewer courses, or dropping out altogether. What was possible 30 or 40 years ago, where student loans would just about cover semester costs and students could earn enough from vacation jobs to graduate almost debt-free, is simply no longer a reality. According to the recent Hope Lab report, 36% of university students and 42% of community college students were food insecure in the 30 days preceding the survey, and 36% of university students and 46% of community college students struggled to pay for housing and utilities, with 9% and 12% respectively being homeless at some point during the preceding 12 months. As the Hope Lab report notes, talking about student food insecurity by itself simply doesn't reflect the complexity of the issue. Instead, we should refer to it as basic needs insecurity. Unfortunately, on the scale of choices that people have to make, food often comes last, and the money that is left over after things like rent, tuition, electricity, medication, and childcare determines the amount that's spent on food. There is a common misconception among students and the public in general that food is the least important of all those things, that students are supposed to survive on ramen because that's just part and parcel of being a student. But paradoxically, without proper nutrition, students face the risk of poor concentration, even depression, with severely negative impacts on their ability to study and complete their courses. There have actually been lots of recent articles and opinions in national newspapers about the high incidence of food insecurity, and Congress has ordered the Government Accountability Office to research the issue this fall in an official report. However, such reports can take years to complete, and even then, implementing any recommendations at the federal level could take even longer. So what do we do in the meantime? Here's a list of some of the initiatives being undertaken at Montgomery College and the universities of Shady Grove to raise awareness about and combat campus food insecurity. They're putting information about where to go for food insecurity help, but also general student needs in their syllabus for every course, so that is one document that every student reads, because one of the big problems was getting students to read and find out where the help is. In fact, I facilitated a student listening session at Montgomery College. One of the questions we asked students was, do you know that there's a mobile market on campus? Do you know where it is? Do you know when it happens? And they were like, We're just like, but you've been talking about how you've been struggling, but there is this resource, but you didn't have, how did you not know? We get so many emails, we don't have time to read them all. So they also did a survey like you guys did, and they're hoping to expand that. There's the Oxfam Hunger Banquet, which you probably all have heard of, which they're hoping to have a specific focus on student food insecurity. They'll have a full event and hackathon in which student teams will work to create almost like a business model of solutions for Montgomery College campus on food insecurity, and then there'll actually be funding available from the college to implement the winning team, their idea. Single stop model, I can talk about that to anyone who's interested. That's having general student screenings happen, like whether it's for homelessness, whether it's for food insecurity, whether it's for childcare needs, whether it's for emergency funding, all in one place. So a student comes in for help and they're given all the options. At USG, they're doing a food insecurity survey as well. They've been distributing this to everyone. They've just been approved to have the Caballero Food Bank mobile market come to their campus. They're looking at doing campus ad campaigns to destigmatize the issue and tell students where they can go. They're looking at nutrition courses, putting together recipe cards specifically with food from the food pantry so that people know how to cook it and what to do with it rather than just like a tin of beans. They're like, what do I do with this? And they're looking to put a student food pantry on campus. Other recommendations, many. I'm hoping that this is kind of more at the general level. And I'm hoping that these slides will be available to anyone afterwards. So you can have a look at those in more detail. But with FoodStat, so this, oh no, it's not going to take us to it. Oh no. Okay, well, This was launched last week, well, on the 1st of May, and what it is we worked with Manor Food Center, Capillary Food Bank, and Montgomery County Department of Health and Human Services to create this online platform that provides context for and further supplements the Feeding America data on the level of food insecurity in the county. And it brings together more than 60 data indicators of need and vulnerability in one place, and we hope that FoodStat will enable government agencies, food assistance providers, and any other interested parties to analyze the community's access to food, its transportation and infrastructure needs, high priority zones and service delivery gaps, and lead to the creation of policies and strategies that will inform priorities, drive collective impact, and reduce food insecurity. And what it looks like is just a map of the county like this, and you can click on various different overlays. So you can see public transportation routes, and then you can put on top of that retail. You can divide retail into fast food or healthy or ethnic. And you can then see who has access to what, where. You can put food assistance providers off of it. You can look at seniors, you can put children, you can look at people on SNAP, you can look at people on farms. And hopefully that'll, by playing with data and seeing the different overlays, you'll really be able to analyze, depending on what you're interested in looking at, who is food insecure in the county, where they are, and therefore what recommendations we can think about drafting to solve the issue. Sorry and thank you. That was very long.
A few more minutes for the questions and discussion for our panel.
A question for Alice. This is something I've always wondered about since you're talking about convenience stores. Maybe you know, I used to live in New York, and almost every corner had a huge, I don't know if you call it a corner store, but it was a huge thing of like produce and flowers and stuff. And it was a huge thing of produce that was actually cheap and very, very accessible. And I've always wondered why DC, Baltimore do not have that. Do you know if that's like a zoning issue or why corner stores don't have more of that produce selection?
Yeah, so one thing is with, I believe, certain zoning requirements, there's like outdoor display restrictions. So in terms of whether or not produce or anything can be displayed outside of the store is one thing. In terms of just like the produce challenges, when we talk with retailers or small stores, they talk about how when they stock this produce, no one buys it, and so the turnaround of it just goes bad, right? And so there's this disconnect that we're seeing where store owners say, well, when we stock it, no one buys it, and then the people in the community say, well, we want it, and the stores don't have it, right? And so for some reason, they're not quite meeting, and so one is trying to figure that out. Another is just price point. In terms of getting, one is if you buy in bulk, does the store have like space to be able to store all of that stuff? And so if they can't, then they have to buy smaller amounts of it for a higher price. And so there's a lot of that wholesale distribution model that people are trying to figure out. And I do know there's like community efforts where, for example, I think Whole Foods is working with a community group sourcing their stuff directly to them, and then that community group is selling those items to corner stores in that neighborhood. But I think there's this type of like group purchasing type of model that people are exploring to figure out ways to make it more accessible for store owners to have that.
Piggybacking on that, I'm from Georgetown, and we're doing a food culture research now, and we're looking at Ward 8, Ward 7, and the issue of the term tornadoes came up in the success of those in certain parts of New York, actually, where there is significant success. And what we looked at was the fact that ownership really drives how successful they are. There's not community ownership, or there's not how it's also marketed within the community, and how it's also displayed. The coloration is very, very important. And they've been very, very successful in terms of certain portions of New York, Brooklyn, Queens. Apparently there has been a lot of success in terms of food waste, has not been an issue. So it really just depends in terms of ownership, how it's packaged, marketing within the community, so that everyone has participation. Has a lot to do with this. When you're talking about Whole Foods and supermarkets where the community is not really engaged in that, it's sort of marketing from the supermarkets to the community rather than the community doing the marketing to other residents and having them actually neighborhood participants, I think has a lot to do with the lack of success.
If I can just add to that. So with the Whole Foods model, it's actually through the group called No Boundaries Coalition. And so they're the ones that are selling the produce. So the folks don't actually know it's Whole Foods. They just know that No Boundaries is the one sourcing it, and it's sourcing from local farms. But I will say one of the challenges is that the folks who own the stores in Baltimore City don't live in Baltimore City. They typically live in Howard County, like in other places, and so the sense of community and ownership is very different. And so that's the challenge that we face.
I was, first of all, thank you so much for the panel and the coverage. I didn't hear the word extension in the discussion, and I wondered to what degree that network in the state is useful and how some of the farmers markets, I know with the SNAP program, have been partnered up could triangularize some of the work that's being done at the county or local level.
I can certainly talk to the fact that extension has been central in what we do. So I mentioned we have 4 working groups. The Food and Beverage Access Working Group, all the groups meet monthly, but the Food and Beverage Access Working Group is the one that's kind of really focusing on the implementation of the food security plan. And Anne-Marie...
Can you speak up a little bit?
Sorry, and Extension come and present what they've been doing. They've been definitely part of the discussions. We also have a food literacy working group, so they're also working with Extension to look at culinary programs, master gardener programs, like kind of community garden programs, things like that, cooking programs to help with resource availability. So they're certainly central to what we do.
I have a question for so I work for Uber Eats and for my income, but I've had to drive to West Baltimore, like Sandtown, Winchester, East Side, Youngstown, Bel Air, Edison, and one, I know the city is not investing any money into that because there are potholes and now spring cleaning in my car. But also like they're now just starting with demolishing a lot of buildings that have like heat violations or uninhabitable. But my question is, why is there so many alcohol stores compared to like grocery stores? Because I feel like it's block after block after block alcohol stores. It's common even in Baltimore County. There's like Middle River, Essex, and all these really high rates of alcoholism. So is there any way to subsidize more grocery and food stores compared to alcohol?
Well, there are some challenges. So in Baltimore City, we just updated our zoning code, and so it's called Transform. And so within certain areas, I guess liquor stores are no longer allowed to open or to exist. So I think they have about a 2-year period before they have to either change their store model or close. And so that's been causing a lot of discussion, is a good way to put it. And also, one thing to point out is a lot of these liquor stores are also immigrant owned, right? And these are older families where it's really hard to come up with a new business model, and they were planning on retiring after this. So there's a lot of challenges with that. I will say that there are ideas of how do we change some of these stores, but I will also say Baltimore City has over 500 corner stores, so we do not need more corner stores. What we need are better stores. And so I think that's kind of the challenge in trying to figure out, okay, what do we do with these liquor stores, and how, if we are calling them to close, what can they become? And I think that's kind of a tricky question right now that we're trying to wrap our heads around, and even figure out what kind of financial incentives are there to help people to transition into a different business, and the fact is there aren't that many. And so I think you bring up a really good point, with no really good answer right now that I can give you, but I think it's definitely a challenge that we're facing.
Speaking of what liquor stores can become, I've noticed that certain things on campus have been replaced with rather expensive options. I'll start with Vigilante Coffee, but there's also Whole Foods popping up, and the prices in that new hotel make my eyes wide. I guess I don't really know what's going on underneath my feet, but I'd like to know if you have any comments on what seems to be a lot of extremely expensive food sources popping up on campus, because I just go to Subway and I hope it never gets replaced.
I
I don't know all the specifics about this campus, but in some of the articles that have been in the national media recently, there was one, for example, about the fact that what do students do in vacations if they have to stay on campus during vacations, the dining halls closed, and then all the other options for them. That's the case here, but and also that there was a rich campus, I think George Washington, where they just put on the menu like a $9 acai bowl breakfast thing. And like students were like, we can't even afford like a basic sandwich. I mean, who is buying this acai? So some of the recommendations that have been made in the kind of national solutions when you think about campus food security are taking EBT cards in campus dining halls, making sure that you have low-cost options on the menu, on all menus of all different franchise holders, having vouchers or emergency grants that the college can give out to people who are really, really struggling. And then also, I think you guys do it here, if I'm not mistaken, the swipe out hunger by redirecting your points, dining points, to people who are not able to afford like a dining package. So, I mean, yes, I totally get it. It seems to be something that's gaining national media attention, this issue, and there are various solutions out there. I think it just depends on the emphasis of each campus to try and think about that holistically and implement those.
Great. I just want to thank you all for coming this morning. If you give a round of applause for our panelists. And I really hope this conversation continues into developing some concrete actions to address these issues. So thanks.